What's going on, guys? Dr. Greg here with Movement Driven. Today we are talking about an exercise called the Kickstand Hinge. This is an exercise I love to do with my clients to get glute activation. I often find that people with low back pain, hip pain, knee pain, foot pain, ankle pain, all have problems activating their glute. It seems to be a very common issue with people that I see on a daily basis. This exercise is meant to kind of teach your nervous system how to accept load in the right area and not guard so much through low back muscles or using knee joint and lumbar spine too much. So for this one, all you'll need is one band and somewhere to tie it to. Let's get started. All right, guys, before we get into the actual exercise, I want to review foot posture and what correct foot posture really means. A lot of people are over concerned about, is my foot flattening too much? Am I supinating too much? Especially if you're a runner, you're talking about pronation, supination a lot. I think generally speaking, we just need to have a really strong foot. You know, the foot is supposed to flatten as we walk, as we run, as we jump. That's part of the mechanism. We want the midfoot to be springy, be strong, be flexible, so that we can use it in the way that it's intended to and be able to push off the toes in sport. So when we talk about stability of the foot or good foot posture, we want to really talk about the tripod of the foot, okay? So that includes the heel and then the two balls of the foot. So right here, right by the knuckle of the first toe, the knuckle of the fifth toe, and the heel, we want to have even pressure between the heel and the ball of the foot. So we want to be 50-50. And a lot of people tend to be too much on their heel or too much on their toe, and we have to find what you are. And then we want to be 50-50 in terms of left and right. We don't want too much excessive weight on the outside of the foot, and we don't want too much on the inside of the foot. So we want to be right in the middle of that heel and then evenly balanced between that first and fifth metatarsal head, or as I referred to before, the knuckle. Okay. So when we put our foot down, we want our toes to splay out ideally, and we want to have equal pressure. And then what you'll notice is when I move my knee in and out, or if my knee goes back and forth, that's going to change the posture of my foot. Okay. So if my knee caves in a little bit, my foot's going to rotate with it, and I'm going to lose that arch, versus if I externally rotate through the hip, my knee comes out, I'm going to build an arch. Similarly, as I come forward with the knee, my foot is flattening. As I come back, it's rising a little bit. Like I said, these are normal functional patterns of the foot, and we just want to enhance it by doing some barefoot training. And we want to really be focused on what the foot is doing, because the foot's not doing its job, there's no way that the glute can do its job, okay? So for the exercise, like I said, all you're gonna need is a simple band, power band, tied around at the level of your knee, okay? You're gonna put it around the inside leg. So right now, I have it around my left side. We're working on this left leg, okay? So I refer to this as a kickstand hinge. So what I mean by that is I wanna have 99% of my weight on this front side, and I'm using this back side as just like a kickstand, a little bit of a balance point, but I'm not loading into that side, okay? So we talked about foot posture. The first thing I want to do is make sure that you're even between the back of the heel and the ball of the foot, and you're loading that midfoot appropriately, okay? So like I said, we're going to be kind of split stance, but not too far back. We want that toe pretty close to the heel here. And then what I want to do is just bend the knee slightly, okay? I'm not going into a squat and loading that quad excessively. I'm just kind of unlocking the knee, so it's a soft knee. And from there, I want a little bit of a hip hinge, okay? Nice neutral spine, neutral pelvis, hips are gliding back. Now the next step is to find that 50-50 from heel to forefoot. So we want to shift our whole body forward. Now notice I'm driving my body forward as a unit, and I'm moving at the ankle, okay? So I'm not just driving my knee forward and having everything else stay back. I have nose over toes, and I'm driving forward, okay? Let me show you from a little bit better angle. Unlock the knee, hinge at the hip, and then my whole body is moving forward until I can really start to splay out the toes. The arch of the foot's going to flatten a little bit, and I have good pressure between the forefoot and the back foot. If you're at home and you're having trouble figuring out if you have good pressure, what you can do is grab a bunch of socks from your sock drawer. You're going to put one sock underneath the midfoot knuckle here, one sock under here, and then one sock on the medial and lateral points of the heel. And when you go back and forth and you think you're at 50-50, What you want to do is have somebody, or you can do it yourself, try to pull those socks out. And if you can pull a sock out, then you know you're not putting enough pressure in that spot. We should have equal pressure in those, the medial lateral heel and the medial lateral ball of the foot. Okay, so back to the exercise. Once we found our position, unlock the knee, hinge forward, shift the entire body at the ankle joint, splay those toes. I'm now in a point where what I want to do is let this hip come towards this knee. Okay, so if I'm working my left leg, the right pelvis is coming down, and you can see my whole leg just kind of drops in a little bit. Okay, so I'm dropping down, I'm rotating towards that, and then what I want to do is make sure that I'm fighting that band. I don't want that knee to be pulled outward by the band. I want that knee tracking right over the middle of my foot. I'm fighting it, and right now my glute is already on fire. Okay, so what I like to do with this one is really maintain that position for 15, 30, 45 seconds, maybe even a minute. And what we're trying to teach the body is to turn off all of these other muscles in this position. My knee joint's not doing too much. My lumbar spine, my low back is not doing too much. My glute is on fire. And then what I want to do is hold to teach the nervous system to accept that load and not be so guarded and fearful of pain that I'm sure you're in if you're looking at this video. What's key for this exercise is how you get out of it. Okay, so we're back in that position, knees flexed, drop in, shifting towards my ball of my foot a little bit. I don't want to just stand out of this position, okay? What I want to do is try to move my pelvis back and forth where I'm extending through the hip, but not necessarily through the knee or the ankle, okay? So here's what I mean. We're back in our position, knees in. When I stand up out of this position, I'm trying to drive hips forward and keeping that knee flexed till I get some good contraction here, and then I can shift back. So now we can make it more of a dynamic exercise where I'm teaching my body to use glute, not the back, not the knee. Staying nice and still through that lumbar spine in that neutral position. I'll naturally get a little bit of this rotation in, rotation out, and we can rep out from this position. Okay? So we have two options. We can hold or we can rep out in and out to kind of work on the motor control of that motion. Now let's talk about those of you that maybe have a foot or ankle issue, and we need to really work on some calf strength and some foot stability in this position. The next progression that I like to do once you figure that first one out is we can drop in that same position, knees flexed, hip hinge. I'm shifting forward a little bit through the ankle joint, drop that hip in. And now what I want to do is continue to shift forward until my heel rises up in the air. So I'm not doing a full calf raise. I'm not going straight up on that front toe. I just want to shift until my heel is just off and my toes are splayed and I'm even between the front ball of foot, nothing through the heel, and I'm just holding. You can see I'm starting to shake a little bit, which tells me this is a weakness point for me. This is something that I need to work on to get that soleus muscle, which is right through that bottom of the calf, really turned on. So again, fighting that green band, I'm here. And again, I can go through and just hold, or I can start to work my hips back and forth, trying to limit my movement through that knee, ankle, and foot complex. Right now, the middle of my arch is on fire, which shows you we're building really good resilience and really good strength of those tiny intrinsic muscles that often get forgotten in the foot. So again, barefoot, try this out, guys. So a little bit lengthy video there, but we're talking about that kickstand hinge, really good for glute activation. Your glutes should be on fire when you're done with that. This one is really good to kind of prime your glutes before a heavy leg day, or just to kind of do a burnout at the end as well. But I love it for the people early on in their rehab process to teach the brain how to load the glute the right way and decrease pain through the system, because at the end of the day, pain is protective. And all it's doing is trying to protect you from a potential injury, even though your injury might have been months or years ago. So we're trying to retrain the brain, which is something that we do a lot here at Movement Driven. And if you're in Jacksonville or St. John's area, please reach out to us.